I see infertility patients, I see pregnancy loss patients, miscarriage patients, breast cancer, gynecologic cancer, PMS, menopause, anxiety, depression, pain. You know, I run an integrated care center for women's health, and so we really see everything. And I'd say for the most part, people really do get better.
My name's Salerno. When I, got married, it was part of my plans that I would have children. And after a year of trying, really felt like, there was some barrier and that we should look into, going to a fertility specialist. And during that time was getting sort of more and more stressed and depressed about the whole process.
The mind cannot differentiate between physical danger and psychological stress. And we have evolved from caveman days to have what's called the fight or flight response. So if you are in physical danger, so if you're walking down the street and you hear footsteps behind you, you're going to have a surge of adrenaline, which allows you to either hit that person much harder than you ordinarily could hit, or run faster away from that person, much faster than you ordinarily could run. And the problem is that we don't need it very often. I mean, when was the last time you needed the fight or flight response to save your life? But your mind can't tell the difference between physical danger and psychological stress. And so if you then take somebody who's going through infertility and is really stressed, if that stress is contributing to her infertility, if you treat that stress, she should be more likely to get pregnant, which is what happens.
So I learned more about Alice Domar's mind-body program for infertility, so I signed up. And each week they would teach us some mind-body technique to apply to our infertility. One would be on eliciting the relaxation response, another on visualization and meditation, another on yoga. And so we just sort of ended up with a toolbox of mind-body techniques that could help us cope with this whole process.
I don't think it all comes down to stress. I mean, there's a huge part of it is genetics. I think a huge part of it is the environment. I think a lot of it is lifestyle factors. And so I look at it in a very different way, that the mind is one of many things that contribute to disease, but conversely, the mind should be one of the many tools you can use to combat disease.
Part of the difficulty of infertility, I believe very strongly, is the isolation, because there's a shame associated with it for some reason in our society. And so just going to the first meeting and seeing all these women in the room that, looked like they were normal, and that was just extremely powerful.
I'm a big believer in social support, because if you look at somebody with infertility, they are surrounded in a fertile world. So their siblings are getting pregnant, and their friends are getting pregnant, and their coworkers are getting pregnant, and movie stars are getting pregnant, and they feel like they're the only one in the world who's struggling with infertility. And then they walk into a room with 15 other women who know exactly how they feel. And I think it's an expression that a crisis shared is half the burden. And so I think that's why social support's so important.
So after a period of using the mind-body techniques that I had learned and acupuncture, I felt that I would proceed to the IVF treatment. And we ended up getting just one embryo, and that embryo took on the first try, and I did conceive and ultimately delivered my first child, my baby boy, Luke.
Most of my research is actually looking at the impact of the mind-body program on infertility patients. And we found was that the women who did the mind-body program had a 55% take-home baby rate compared to a 20% take-home baby rate in the control group. And then we got a grant to look at the impact of the mind-body program on IVF. And what we found was for their second IVF cycle, where I think 76% of the mind-body patients had actually done the program, we had a 52% pregnancy rate versus a 20% rate in the controls. So 52%, 20%, which is almost identical to the pregnancy rate differential in the first study. If you look at the data that I've collected in my career on the impact of the mind-body program on fertility rates in infertility patients, and the fact the program cost a few $100s and pretty much doubles pregnancy rates. Yes, if you had a pill that did that, every infertility patient in the country would take it.